So how are you feeling this weekend? It's time for Weekend Wellness presented by Sonder Health Plans. Join Home Team Brandon Leak and CEO of Sonder Health, Susanna Roberts, as they discuss your health, the latest healthcare news, mental health, fitness, and so much more. So let's start feeling better. It's time for Weekend Wellness on Extra 106.3.
Welcome back into the Weekend Wellness Show, brought to you by Sonder Health Plans. Sonder Health Plans, your doctors, your neighbors, your friends. We reconvene after having some time off, and now we get a chance to get back into conversations that deal with matters of health. A great conversation will be had today as we are joined by a man who is a master of his craft. From the Atlanta Fibroid Center, he is Dr. John Lipman, who joins us here, a board-certified interventional radiologist who is globally recognized for his unparalleled expertise in fibroid treatment, particularly in uterine fibroid embolization, UFE. We'll have him explain that. He's conducted more than 10,000 procedures, renowned worldwide as the most experienced UFE physician. And beyond the practice, this guy is an award-winning public speaker, so we know we're going to have a good conversation today. He's an accomplished author, and he is a man who is passionate about his work and is pioneering in the world of medicine. Dr. Lipman, thank you so much for your time today here on the Weekend Wellness Show.
No, it's my pleasure. Thanks for having me. It sounds like you talked to my mom or something with that intro.
You've done certainly a lot of good works and good deeds, and we'll get to some of those over the course of the program.
Appreciate it.
You also are part of Atlanta history. Now, me and my sports background, I do a little digging around, a little research, and you're a passionate hockey fan.
I am.
Being that we've had two opportunities so far, maybe a third coming down the pipe, if you believe what you read, crossing our fingers. Two hockey teams in town, the Flames, who ended up in Calgary, and the Thrashers, who ended up in Winnipeg. You have been a diehard hockey fan, and you are part of Atlanta hockey history as you and a friend of the show in Sonder Health Plans, Dr. Slaker. You guys were some of the first ever Atlanta Thrasher season ticket holders when the Thrashers came to Atlanta.
Yeah, I got a very good lottery number, which I was thrilled at. And so, yeah, from day one, I sat right behind the players' bench at the red line. So I got great seats. And we're just very passionate about the Thrashers. And now I've adopted the Winnipeg Jets.
Okay.
So hopefully this year is the year they're going to win the Cup. We'll see. It's exciting.
When you look at doctors, they're always walking around, they're always going somewhere. You use time for a sports outlet. You have your wonderful wife that's come. I was talking to her. You have 3 children, and you guys have done the American, let's get it together, let's see how things work out thing. What's it like being a doctor and a physician in a town where you've been for a long time and watch yourself, your family, and your children grow?
Well, I'm not a native Atlantan, and that's kind of hard to find, but I'm kind of a common law Atlantan. I've been here over 30 years, and so very passionate about the Atlanta sports teams. I adopted all of them, and so we love going and seeing them play not only at home but even on the road. And whether it's hockey, whether it's football, whether it's baseball with the Braves. Longtime listeners of 680 The Fan, and so I was excited to come here and kind of see the place because I've been listening to them for years. So. Yeah, it's all good.
Can I take you up to Flowery Branch as a physician? You have healing hands. We want you to touch the Falcons. We need healing right now in the city and for the draft that's on the way.
We do. We definitely do. And somehow, hopefully, we got to just get some better drafts going so we can make some noise in the NFL.
Yeah, hopefully it'll come soon and very soon. Well, let's get into what got you interested in the world of medicine. Everybody asks a kid what he wants to be, or what he wants to be when they grow up. What got you into the world in the field of medicine?
Well, my dad's a physician, or was a physician for many years, and my mom was a nurse, and so I had a medical, background, just being exposed to the great work that they were doing. And then when I got into medical school, I had the great fortune of reaching out to a local physician in D.C. I went to Georgetown Medical School, and there was a guy doing just amazing work at a small hospital, and it turned out he is an icon now in the field. But I wrote to him as a medical student saying, can I just spend some time with you? And he was flattered. He had never had a medical student, and he was kind of under the radar doing just amazing work in interventional radiology. And now he's like Hall of Fame icon. I mean, he's just a Barry Katzen. He started the Miami Vascular Center, which is a multidisciplinary, world-renowned vascular clinic and at Miami Vascular Hospital. Just a tremendous individual. And I just had the good fortune of watching and spending time with him. And once I did, I knew exactly what I wanted to do, because there were only two things I ever considered: doctor, baseball player. And I was playing through college, a little bit after college, but it was clear. I grew up in upstate New York, and we would go down to Florida in the spring, and we would get our hat handed to us because these guys were playing year round. And so it was pretty clear that I wasn't going to be a baseball player professionally, and I better stick to medicine and get to hitting the books.
1,000 different avenues and options for you to be in the world of medicine. What was it about radiology that said, you know what, this works, I like it, and I'm passionate about this?
Yeah, after spending time with Dr. Katzen, it was clear, because interventional radiology, for those that aren't familiar with it, it replaces what has been traditionally done by surgery by procedures done from the inside. So we invented angioplasty, which people know about in the heart. Opening up blocked blood vessels. That was an interventional radiologist, Charles Dotter, invented that technology. We also invented the stent, the metal scaffold that once you dilate open an artery, it keeps the artery open. So angioplasty and stents were created and invented by interventional radiologists. And we do that all over the body. So we replace the need for surgery. And my particular niche is replacing surgery for uterine fibroids, whether it's hysterectomy, removing the uterus, or myomectomy, removing some of the fibroids in the uterus and sewing the uterus back together. We have a procedure called UFE, Uterine Fibroid Embolization, which is outpatient, non-surgical, no surgery at all, no general anesthesia, no hospital, 30-minute procedure. You go home the same day with a Band-Aid. You get the relief of symptoms, you avoid the risks and long recovery of surgery, and importantly, and often underappreciated by many doctors, you get to keep all your parts, which is huge. There's a lot of dysfunction that happens to women after they lose their uterus.
Well, it sounds like something that a fantastic leap forward in procedures and technology like that would be just what everybody needed, and we'll get to that a little bit later. Apparently, there could be a little controversy when you help folks in that manner.
Yeah, there is. I mean, unfortunately, the gynecologists haven't really embraced UFE. They're the gatekeepers of women's health. And so when women are suffering with fibroids, and it's the number one reason why women have heavy periods. And so that's usually the presentation. They're often associated with a lot of pelvic pain, urinary frequency. So they'll go to the gynecologist because that makes sense. They're the gatekeepers of women's health. The gynecologist will examine them, and you can feel these fibroids. They're rock hard, and that's how they cause their symptoms. And it's based on location in the uterus. Those near the lining cause those heavy periods I mentioned, and they're horrific, like crime scenes. Ones laterally will press on pelvic nerves to cause pain. They'll press on the bladder to cause urinary frequency. So they get a lot of symptoms, and so it can be felt on physical exam. It enlarges the uterus like a pregnant woman, so they'll often go, wow, I think you have fibroids. That explains your symptoms. Let's get an ultrasound and confirm it. They confirm it, and then they ask them, are you interested in fertility? Because if you aren't, they say, well, you don't need that uterus anymore. Get a hysterectomy. And if they are, they tell them to get a myomectomy, cut out some of the fibroids, sew the uterus back together, relieve their symptoms, and hope they can get pregnant and have a child. But oftentimes, they don't mention UFE at all, and that's a shame, because women are entitled to know all the options, not just the surgical ones, but they often, and there have been many studies showing this, they just don't mention UFE at all. And it's one of the biggest medical breakthroughs for women, particularly African-American women, who disproportionately suffer with these benign tumors. Fibroids are benign, I didn't mention that, but they are benign tumors, and the most common pelvic tumor seen in women, the most common reason why women have heavy periods, and unfortunately, and we're trying to change this, the most common reason why women get hysterectomy, because there are close to 700,000 hysterectomies done every year.
Wow.
Most commonly, by far, for these benign tumors. And this is an amputation. We're removing an organ that the woman was born with. So my question is, why are we essentially doing amputation to young black women for benign disease.
Is it for money? Because if there are other options, and sometimes that might be the right route to go, but if there are other options, clearly options that are non-invasive, it sounds like what I'm picking up on is it's more beneficial to perform surgeries where you get paid for that as opposed to send them to some place where you don't perform surgery and you don't get paid for it.
Yeah, it's clearly been shown how safe and effective UFE is. So it's no longer, well, we haven't seen enough data. We've been doing UFE over 25 years. So it's well proven, safe, and effective. And in 2008, the American College of Obstetrics and Gynecologists gave it its sanction, saying, yes, with the highest level of medical evidence available, level A, the highest level of evidence, this is safe and effective and should be used in women that don't want surgery if they're suffering with fibroids. Yet the rank and file don't seem to have read that memo, and they're surgeons. And all gynecologists are surgeons, and surgeons, let's face it, they like to operate. And even though women are entitled to know all the options, most commonly they won't hear about it. So you have to kind of know somebody or learn about it on the internet, and it's really sad because they're dropping their responsibility. Say women are entitled to know all the options, not just the surgical ones, and it's a real shame because the UFE is, as I say, one of the most significant breakthroughs for women. I'd put it up there with the mammogram and the pap smear in terms of significance to the women, particularly women of color.
He's Dr. John Lipman from the Atlanta Fibroid Center. I'm home team Brandon Leak. You're listening to the Weekend Wellness Show brought to you by Sonder Health Plans. When we get back, you would be shocked and surprised at how early when fibroids can become issues in this country. Dr. Lipman will help us walk through that as well as get us information on how everybody can be wiser when we return here on the Weekend Wellness Show.
This is Weekend Wellness, presented by Sonder Health Plans, with home team Brandon Leak and Sonder CEO Susanna Roberts on Extra 106.3 FM and the Extra 106.3 app.
Welcome back into the Weekend Wellness Show brought to you by Sonder Health Plans. Remember, Sonder Health Plans, your doctors, your neighbors, your friends, typically joined by Susanna Roberts, CEO of Sonder Health Plans. And today our guest is Dr. John Lipman from the Atlanta Fibroid Center, who is a part of very innovative procedures and technology that he is able to use to make better lives and make healthier patients that come in and see him. And we were talking about what information women need when they're having issues with their fibroids. And one of the procedures that you are a part of that is non-invasive and seems to be the smarter way to approach it, where you don't have to cut into a human body, take out human body parts, and maybe alter the chemistry of a human being if there's a better way to do it, which is the better way it seems to do it. So let's get into exactly what the procedure is, what is it called, and how do you get a patient prepped for the procedure that you perform?
The procedure is called Uterine Fibroid Embolization, UFE, and some people call it uterine artery embolization, UAE. It's the same procedure. Under X-ray guidance, I can steer a little tiny catheter, it's the size of a piece of spaghetti, into each of the uterine arteries one at a time. Each of those uterine arteries are like trees. I'm in the big trunk of the tree, and it starts branching, getting smaller and smaller and smaller branches till you get out to the leaves. The fibroids are the leaves of the tree, and I know what size those small, tiny peripheral branches that are feeding all the different fibroids, I know what size they are, and I can flow direct particles that will block the blood supply to all the fibroids in the uterus. Without a blood supply, the fibroids die, and as they die, they soften and shrink, and as that goes on, a woman's symptoms start to fade away and disappear. The big trunk and the main branches of the uterus, they're all open. So the uterus stays alive, and we've had numerous children after UFE. We've had multiple twin births. And the births that we've had after UFE, as long as they've never had fibroid surgery before, are typically full-term and vaginal, whereas as soon as they've been cut on surgically and had fibroid surgery, a myomectomy, all of those patients are going to get even more surgery, a C-section. So the two most common surgeries done in the United States, number one, C-section, number two, hysterectomy for fibroids. And our mission is we want to stop hysterectomies for benign fibroids. It's oftentimes a first-line option, and it really should be relegated to a last option. We've tried everything on the shelf, including UFE. It's not working. Okay, you could have a hysterectomy, but the success of UFE is over 90%. Very likely they'll get the relief they're looking for, and it really should be something that all women struggling with fibroids, they all need to know about this tremendous, transformational, life-changing procedure. But unfortunately, the gatekeepers of women's health have kind of kept this under wraps, and it's really sad as a physician myself. The gynecologists in general have kind of let patients down. In fact, I don't know how they sleep at night. I really don't.
How do you advocate for this information? You just gave all of the answers. It would reduce the number of C-sections, which is surgery. It would reduce the number of hysterectomies, which is surgery. You would have fewer surgeries on people and allow them to have natural childbirths in a lot of cases if you go in a different route that is counter to what is being recommended repeatedly in this country.
Right. Well, our patients go home the same day of the procedure, and it's not done at a hospital. It's done at our center, so it's less expensive. Anything in the hospital, just multiply what it should cost, multiply it by 2 or 3 anytime you deal with a hospital. So the procedure is less expensive. It's obviously less invasive. They're going home the same day, literally with a Band-Aid at the top of their right leg where we entered. So it's less invasive. The recovery is much shorter. The recovery is usually about 5 days. Recovery from hysterectomy, and most hysterectomies, even though there's a lot of robotic and laparoscopic hysterectomies, most hysterectomies are done open, either horizontally, like a C-section, or vertically. These fibroids can get big, and these uteruses get very big. They sometimes have to cut a woman from her breastbone vertically all the way down to her pubic hairline. Big time surgery. Say our patients go home with a Band-Aid. So instead of 2 or 3 days or more in the hospital and 2 months out of work recovering from this major surgery, patients go home the same day, 5-day recovery. The next day they're up and mobile, walking around. And a lot of them are working from home 2 or 3 days and back at work in the office 5 or 6 days.
Well, when you look at those options, when you go into recovery, what is the difference? You just talked about not obviously having yourself cut open if you choose the UAE route. What does that still entail in the recovery? Soreness, getting back to yourself, how long are you off, and how does that compare to a traditional hysterectomy?
Yeah, so our recovery is usually 5-6 days that they're out of work, and hysterectomy is 6 to 8 weeks, usually closer to 8 than 6. So it's a much longer recovery for surgery. And women are able to keep their uterus, which again is undervalued by a lot of gynecologists. Women are changed psychologically. The average age of hysterectomy in this country is less than 40. So these are women, could be in their late 20s or 30s or even 40s. These are young women. And they're losing their uterus, which affects them. It can affect them psychologically, like a man being castrated. It affects a lot of women sexually, loss of libido, loss of orgasm. And these are embarrassing to talk about. So they keep it to themselves. There's a lot of bone loss after hysterectomy, urinary leaking. It's unnecessary.
It almost sounds like lobotomy.
Right.
It's outdated.
Right.
It's archaic. We don't do it anymore. We found advancements in medicine and procedures, so it needs to stop or be significantly reduced. Why is this not a cry from the mountaintop from millions of people who have gone through one side of that experience in the medical field, and then the women who live a different life with the procedures that you are able to help them be a part of?
Well, you've heard my cry from the mountains. That's my life's work. I've been doing UFE here in Atlanta. I did the very first one here in Georgia over 25 years ago, and I've been doing them ever since, and I have amassed the largest experience in UFE in the country, and that's my life's work. I do UFE every single day, and I speak all throughout the country on how we need to change how we treat patients with fibroids. And, we can talk about the pretty ugly history that we have in the South in treating black women with hysterectomies, the Fannie Lou Hamers, Mississippi appendectomies, operating and sterilizing black women when they didn't need any hysterectomy. And so we've got to get beyond that mentality and stop doing hysterectomies for benign disease. We have a better mousetrap. It's called UFE. It's a much better procedure. It's safer. It's less invasive. It gets the women the relief they're looking for without any surgery. You get to keep all your parts, even have children naturally, vaginally. It's a no-brainer. We just have to keep talking about it and hoping to get a national conversation going. As I say, we talk to anybody that'll listen. I speak all over the country. We've done documentaries where we've put out, these films. Sometimes celebrities will help us. Cynthia Bailey, who I can mention from Real Housewives.
Here in Atlanta.
She was my patient, and we were on Real Housewives, and she brought a lot of attention to it, and I really appreciate her courage because, she's an attractive model, talking about embarrassing periods and stuff, but she had the courage to say, this is my story. I can help a lot of women because she was, her life was transformed, literally transformed by UFE. It saved her marriage at the time because she was bleeding so heavily. Her and her husband stopped having relations. From her husband's point of view, he was looking at it like she must not love me anymore because he wasn't getting his because she was bleeding so horribly and she was wearing adult diapers. So imagine you're bleeding so often and you're having to wear this gear all the time. You don't feel very sexual. Plus, losing all that blood, she was anemic, which means you're tired, you're weak. It was all she could do to just do her job, and she'd get home and she'd be wiped out. So once she had the UFE procedure, we corrected her anemia. She wasn't bleeding heavily anymore, so she built up her iron and hemoglobin naturally. All of a sudden, she had this rocket boost of energy. She didn't have to wear adult diapers anymore. She could wear the silky, stuff and feel sexy about herself again. And then Peter, their relationship resumed, and it was transformational. So it is transformational for a lot of these women. They just don't know about it.
You're listening to Dr. John Lipman from the Atlanta Fibroid Center joining us here on the Weekend Wellness Show, brought to you by Sonder Health Plans. You can go to sonderhealthplans.com to get a fantastic health plan for you or family members. To that point, how is this covered? Is this something outside the scope of what a normal insurance policy would cover?
No, it's covered by all major insurance plans, including Medicare, Medicaid. We take Medicaid. A lot of specialists won't, but I feel that it's our responsibility to take Medicaid, and we take all plans, and all plans will cover this. Now, everybody's plan might be individualized, but all the major insurance carriers cover it, including government payers and TRICARE. All of them cover it.
Who are candidates for the procedure? Is everyone who needs it available to have it? And are there some exclusions or people who might be in a high risk category?
If you have symptoms, not all patients with fibroids have symptoms. If they have significant symptoms, whether it's heavy bleeding, pelvic pain, urinary frequency, waking up at night to urinate, those are the main three symptoms. There are others. If you have symptoms, then likely you're a candidate. You need to see an interventional radiologist like myself at Atlanta Fibroid Center to see if you are a candidate. But if you have symptoms and it's due to fibroids, almost assuredly you're a candidate. Almost, I'd say, 99% of patients that are told they have to have hysterectomy for fibroids, 99% of them are candidates for UFE. So no matter what the gynecologist says, you need to get that second opinion. That's really important because I hear all the time, oh, well, my doctor said I brought up UFE and my doctor said I wouldn't be a candidate. My fibroids are too big, or I have too many of them, or I would still need a hysterectomy anyway. False, false, and false. Those are just false statements. So never too big, never too many. You're very unlikely to have a hysterectomy ever if you get UFE. It works in almost everybody, say over 90% of the time. It's worth doing before major surgery.
When you talk about symptoms, which you have earlier in the show, what are some symptoms that are normal and typical, and what are some that might be overlooked that women might think maybe something else or might not be a big deal?
Well, sometimes women bleed very heavily, and yet they think it's normal, and it's not. Because you got to ask the questions. Oh, how many days of bleeding? How often do you change your pads? Anybody that's changing more frequently than every 3 hours, or blood, they sit down, they stand up, blood gushes out or floods, or they need multiple pads at a time, or multiple pads and tampons or diapers or period panties. That's too heavy, no matter how long you've been doing it. So I tell patients, if it's interfering with your quality of life, no matter what your hemoglobin level is, no matter what your doctor says, that's not normal, no matter how long you've been doing it. So sometimes the biggest challenge is they don't realize that what they're bleeding like is not normal. And I'll tell them, once you have the UFE procedure, I'll show you what a normal period should be.
Well, when you have people, sometimes they are living with something, sometimes they let things go on longer. They get used to the uncomfortability, or maybe some things that are a little bit stressful. They get used to it. They don't get it checked out as soon as possible. What is your message to women who have been dealing with things? Yeah, there might be something here, but I'll get to it later down the road.
If you have fibroids and you've just been pushing it through, get that second opinion. Come and see if you're having fibroids, get that second opinion and see. You don't have to suffer needlessly. There are over 1 million women in the United States that we call the silent sufferers. They have fibroids. They've been told they had to have a hysterectomy. They don't want to do it, and I understand why, but they haven't been told about UFE. So they just suffer with it needlessly, month after month after month. And you don't have to do those. You don't have to suffer. You don't have to just push it through. Get a second opinion, see an interventional radiologist like us at the Atlanta Fibroid Center or wherever, and look into UFE. As I say, it's life-changing. You don't have to suffer needlessly in silence when this procedure is readily available in any major city throughout the country.
What are follow-ups? There are different procedures, different parts of the body that do different things. If you have LASIK, eventually you have to go back in and you will have to wear readers down the line, those types of things. What are some of the things women have to be prepared for after they have the procedure?
Well, after the procedure, there's some, pain and discomfort afterwards that's very easily controlled with medication. And that's what they're recovering from, that 5-day recovery or so, 5-6 days that I mentioned previously. And then once they're recovered, we will see them at 3 months. And at 3 months, usually they're a new woman. Their symptoms are at least significantly better or completely gone. And we look at MRI imaging and see that all the fibroids are dead. If the fibroids are dead and she can tell she's at least significantly better and she's over 40, likely I'll never see them again unless I get a baby announcement. They'll send a baby picture.
I was going to ask you have many testimonials or thank you, doctor, because we were able to have children. We were able to have a family. I did not have to do something to save myself that may have cost me a chance at a family life that I wanted.
Come into our office. We have a baby wall. Looks like a gynecology office because it's all with baby pictures and thank yous. We had a patient that was in her late 30s I saw a number of years ago, and she went to the gynecologist and they said, you've got to have a hysterectomy. And she's like, oh, gosh, I really don't want that. Is there anything else? And they said, no. And so she suffered for a while, and then she found out about what we were doing, came in, and I said, no, you don't need a hysterectomy. You're a candidate for UFE, like 99% of the people are. She did the UFE procedure. She got complete relief of her symptoms, and her gynecologist couldn't understand why she was so reluctant to undergo hysterectomy, and she said that she wanted to have a child, or at least try. She had no children. And he's like, well, you're in your late 30s and you're single. That ship has sailed. And so, whoa, I was like,
not necessarily.
Yeah. So I was apologizing for this really crass physician that I didn't even know who it was. And I was like, oh, I'm sorry. I'm so sorry. I can't believe he said that. And then, so after the procedure and she recovered, she did great. She met a man in church. They got married, and lo and behold, they had a child. And she sent me this really nice, heartfelt handwritten letter with a baby picture. And she says, thank you so much. God bless you. You were responsible for my miracle baby, Jalen. And so fast forward to about 2 years ago, This was back in, I think, 2002 when I got the original letter. It's like a couple years ago, 2-3 years ago, and there's a knock at the door at the end of the day, and my front office staff says, "There's somebody here to see you." I'm like, "Oh, I thought we were finished seeing patients." She's like, "We are. I don't know who it is." So I came out, and it was this woman, and she's like, "I know you don't remember me, Doc, but I had the miracle baby Jalen." I'm like, "Oh, of course, yes. How can I forget?" And she's like, "Come outside. I want to show you something." So I open the door to my office, walk out to the parking lot. There's Jalen coming out of the driver's side of the car. He had just graduated high school. He brought me his graduation picture, a little wallet size. So I said, "Jalen, come on in. I want to show you something." We went to our wall. There was his baby picture. We put his, if you come in, you'll see the baby picture and the high school picture side by side. And she goes, "Doc, I was this close," holding her index finger and her thumb so close together. She's like, "I was this close to getting a hysterectomy. I was just worn out. I was fatigued. I just like, I had it. I was just going to throw the towel in. But you saved me. I have this miracle now, and I can never repay you. I can't." And it's like, this is the fuel that keeps me coming to work every day. I mean, it's how can you not love what you do when you see the transformation that happens in women that think they're going to lose body parts and they get their life back and even have children after. I have the best job in the world. I am so blessed, and I feel very fortunate that I can, alter the trajectory, if you will.
That is one of the more fantastic stories I have ever heard, and that is what medicine and doctor and physician care to patients should always be. And it's clear, just that one story, anybody who has crossed your path has certainly had a magnificent person as well as a magnificent physician trying to help them get the best information they can. You know what? Coming up, I want you to walk us through. Somebody makes the call. Somebody goes to the website for the first time. They got some poor bedside manners. They got some misinformation for the first time they come see you. Walk us through and then tell us about things outside of what you do in the office. An author, an accomplished author, and a speaker. And clearly how you impacted me and impacted some folks listening today, it's clear when you get in front of folks, you're going to change some lives. So we'll talk about some of those things when we return. He is Dr. John Lipman from the Atlanta Fibroid Center. I'm home team Brandon Leak. This is the Weekend Wellness Show brought to you by Sonder Health Plans. Hey there, Atlanta sports fans. Home team here with Sonder Health Plans. I've been singing praises about their Georgia-based Medicare Advantage health plans, and now they're stepping up their game with new plans that include home safety and accessibility modifications. Sonder Health Plans is all about keeping you healthy and thriving right in the comfort of your own home. Sonder is committed to revolutionizing healthcare, making it straightforward, personal, and affordable. Call them up and ask if you qualify for their fantastic $400 grocery card offer and $0 premiums. Let's illuminate Sonder Health Plans, your go-to for top-notch Medicare coverage right here in Georgia. They're not just another Medicare company. They're providing tailor-made care that's all about Georgians taking care of Georgians. They've got their very own radio show and podcast hosted by yours truly called Weekend Wellness, dedicated to keeping all Georgians healthy and happy at every age. Don't let those unexpected medical costs catch you off guard. Call 800-331-2928 or visit SonderHealthPlans.com. Sonder Health Plans is an HMO with a Medicare contract. Enrollment in Sonder Health Plans depends on contract renewal.
Feeling good this weekend. Now back to Weekend Wellness presented by Sonder Health Plans. Live on Extra 106.3 FM and stream the show anytime on the Extra 106.3 app.
Getting ready for the grand finale here on the Weekend Wellness Show brought to you by Sonder Health Plans. Remember, Sonder Health Plans, your doctors, your neighbors, your friends. The show focused on informative, healthy information, and we certainly have been informed well so far by Dr. John Lipman from the Atlanta Fibroid Center, and he is a maverick in the world of fibroids and helping women get the best choices for their bodies and long-term great health care. And we were talking about what happens when somebody goes to their physician, then they end up going to their gynecologist, and then they get a recommendation. I'm not sure if I want to get a hysterectomy. You know what? I found out about some things, Dr. Lipman. What happens when they go to your website? What is the walk into the office, and how do you walk them through all of your procedures?
Well, we'll get the information so we don't want to duplicate stuff from the gynecologist. So we'll get the history and physical. We'll get the ultrasound report. They've all had pelvic ultrasounds with a gynecologist. And so the appointment with us is a consultation. We've gotten the history and physical and lab data. We've gotten the imaging from the ultrasound, and we use even better imaging called MRI, magnetic resonance imaging. It's a much, much higher resolution of the entire pelvis, including the uterus and surrounding structures. So all the patients will get an MRI of their pelvis, and then they'll come to our office and we'll go over the MRI with them. We'll also talk about their symptoms, because to be a candidate for UFE is you've got to have symptoms. They got to have these symptoms, whether it's bleeding, pain, urinary frequency, or typically all three. So they have symptoms, and then they have fibroids, and we'll see them to great detail on the imaging, and it has to fit. Because every now and then, occasionally, somebody will say, well, is there patients that are not candidates? Well, for instance, we had a patient that had a fibroid that was hanging on the outer part of her uterus, nowhere near the lining of her uterus. The ones that are near the lining, called submucosal fibroids, those are the ones that cause the heavy bleeding. She had a subserosal fibroid hanging off the outer part, nowhere near the lining. And she came into the office saying, I want to do a UFE. I know you're the guy. I want to have it done. And I'm having heavy periods. So she had heavy periods. She did have a fibroid, but I knew that fibroid wasn't causing heavy bleeding. So I told her, in your particular instance, you're not a candidate. We did a special ultrasound to show that she had polyps on the lining of her uterus that were causing the heavy bleeding, and we could direct the gynecologist exactly where these polyps were. She had them removed, and she got her symptoms addressed. But if a woman has been told that she needs surgery for her fibroids, 99% of them will be candidates for UFE. So typically they will be candidates, and we'll go over all the different options, whether it's surgical, whether it's UFE, and let the woman decide, what she wants to go and going forward. If she wants to proceed with UFE, we'll go forward and schedule it.
And you're able to put everything you do out for public consumption. People go to your YouTube page and watch a procedure.
Yep.
And we were talking, this isn't like a pimple popping show, so you don't have to worry about a lot of things that we see on that show while you're watching, but you get to see exactly what non-invasive procedures look like, which I'm sure would make a lot of women comfortable when they can see what it is you can do for them.
Yeah, they can't believe how simple it is. I mean, step by step, they see the approach is at the top of the right leg, and there's little tiny nick in the skin that we make, and it's covered by the pad of a regular Band-Aid. So they can have the equivalent of major surgery all done from the inside, and all they have is a Band-Aid, and they go home the same day. It's remarkable. It's a tremendous procedure. Everybody needs to know about it. If you're suffering with fibroids, get that second opinion from an interventional radiologist. And if you're here in Atlanta, or even beyond Atlanta, we'd be happy to talk to them further at the Atlanta Fibroid Center.
And where can they see a procedure such as the one you do on a regular basis on YouTube?
Yeah, if they go to our YouTube channel, it's Atlanta Fibroid Center, they'll see hundreds of videos on fibroids, on the UFE procedure. They can watch me do a UFE. That's one of the more popular ones. They can find me on our website. Our website has a lot of information there, too. That's atlii.com. If they are an IG person, they can go to our IG page. It's literally my name, dr_my last name, Lipman. So there's a lot of information there. We did a thing recently with Damon John from Shark Tank. They can see that on our IG page. There's a lot of infographics and testimonials. If they want to see someone who's actually had the procedure, we've got hundreds and hundreds of testimonials from transformed women who got their life back after UFE.
Outside of UFE, you have been an author and you have been a public speaker. Talk about how those avenues help fuel your passion in getting out great information to women around the country.
Well, I got an award.
And the men, too. Guys need to know a little bit more. I'm going to fancy myself now just spending an hour with you as the foremost expert on our show here on 680 The Fan in Atlanta. As I've learned quite a great deal in just an hour, I can imagine what you have taught around the country over the years.
Well, we're thrilled. We have lots of events throughout the year, women's events, and we talk to church groups, African-American sororities. I was... A while back, I spoke at AKAs. They just had their Founders Day. I was at their Southeastern Conference, the South Atlantic Conference in Orlando. Thousands of African-American women. I was honored to speak at that event. I'm hoping to go to a boule. That's like the big deal. Maybe we'll see. But women's groups, I'll talk for hours for anybody that'll listen about fibroids. But while I really enjoy that, I got an award. It was, and I'm a huge sports guy, as you know. I got a EPSY award. Oh, it was a public speaking. EPS. The PS in EPSY is public speaking. So I was in D.C. I got awarded an EPSY, and initially when it came through, being the huge sports guy, I was like, "Damn, I got an ESPY award!" I was like, "This is great. That's made my day." And they're like, "Whoa, dial it down, Doc. You didn't win an ESPY." And it was great that, in public speaking award was phenomenal. I don't want to demean that, but being a huge sports guy, I just thought it was kind of hilarious that that was my ESPY award. And
look good in the man cave too.
Yeah, go put it in the man cave. But I enjoy public speaking. It's, UFE is one of the biggest medical breakthroughs for women, particularly women of color who disproportionately suffer with these benign tumors. So I enjoy going out and meeting people, educating them, because they're entitled to know all the options. And hopefully they'll find the relief they're looking for with UFE. And so I really enjoy that. It's my life's work. It's my mission. I want to stop unnecessary hysterectomies for benign disease. And so anybody knows me knows I'll talk to any group, anybody will listen, from several to several thousand.
Well, you certainly, sir, Dr. Lipman, are a drum major for what is right, and that is giving people all of the information they can to be as healthy as they could possibly be. We certainly thank you. We are fortunate and blessed to have you as our guest this week. We thank you for your time. Those sites, again, atlii.com is where you can go. You can find Dr. Lipman on Instagram at Dr_Lipman. That's Dr_LIPMAN. And you can find all of his procedures, or a lot of procedures that certainly will make us all wiser, on YouTube if you go to Atlanta Fibroid Center on YouTube. Well, Dr. Lipman, we thank you for your time. We certainly hope to run into you again, and we are thankful that you made everybody listening a lot wiser and gave everybody a lot more option to be healthy.
Well, I appreciate the invitation. Hopefully I can come back and we'll do some sports talk, whether it's hockey, Falcons, Braves. Hopefully I can share my other passions through sports and sports talk.
Well, I'm afraid, because if you're as good at talking sports as you are about talking about fibroids, I'm going to be out of a gig. But thank you for your time. Please make sure you check out all of his information. And women who do need, or if you know someone who needs help with fibroids and non-invasive opportunities, this is certainly the man you should have touching you or your loved ones with his healing hands. That will do it for the Weekend Wellness Show, brought to you by Sonder Health Plans, for Susanna Roberts, CEO of Sonder Health Plans. I'm Home Team Brandon Leak. We'll see you next time when we reconvene on the Weekend Wellness Show.